This is one of our modules on post-COVID-19 recovery education, and today's module is about brain fog, a very common complaint that some of the patients who have had COVID will describe. In this module, we hope to share with you what we do know about brain fog or cognitive blunting after COVID-19 infection. We want to share tools and strategies to help minimize and manage symptoms and to support you in your own self-management. You have to realize you are not alone, as a lot of patients are describing residual symptoms, cognitive fogging after COVID-19. It is really common to have fatigue while you're trying to learn new information, and trying to talk about cognitive fogging may lead to increased symptoms while you're trying to learn about it. You might want to reduce the brightness of your screen so it is not irritating, reduce noise and interruptions around you, and you may need to take breaks and do this module in smaller chunks or pieces. So what is this thing called brain fog? It's not really a medical term, but it's how patients describe the feeling that they have, that their usual thinking process or cognition is blunted and challenging for them. There can be problems with attention, concentration, memory, speed of thought and mental planning, problem solving, and they will describe it as trouble focusing or shifting attention from one thing to the next thing. They sometimes have trouble with confusion, trying to remember where they're at. From the outside, they can look to be slow, and some people will mistake the patient as being depressed when in fact they are struggling to process information. All of this can lead to poor memory and retrieval, and trying to learn new things can lead to mental fatigue. Just processing day-to-day functions can be a heavier burden than usual. What causes brain fog after COVID-19 infection? This is still so new that we have a lot of learning to do. There are some possible reasons. Some cases may be because the patient was very ill and on a ventilator, and maybe hypoxia was a problem. Other cases may have had a mild form of inflammation of the vessels of the brain or the coverings of the brain, like a meningitis. And in very rare cases, hypercoagulation may have caused small strokes. But many people get these symptoms even if there are no structural changes to the brain. And some patients didn't even have a very severe infection with COVID, didn't go to their doctor, or may not have been tested as there weren't enough kits when we started this journey. Usually the brain tissue isn't damaged or structurally changed, and it's more of a software problem than a hardware problem. Thinking of the brain like a computer can sometimes help in some of the strategies to make it work better. But giving the brain a chance to process and adding more time and strategies is the methods that we'll teach you. How common is brain fog? It is really quite common. The exact percentage is still unfolding as we continue our journey collecting data and understanding this virus. It's not really a specific diagnosis, and some of the symptoms overlap a lot with other conditions such as anxiety, insomnia, post-concussive-like symptoms. Anybody who has had some of these before will sometimes be aggravated by their COVID infection. The estimate is quite wide, as low as 10% or up to 50% of patients who have had COVID-19 could have the combination of brain fog, fatigue, muscle or joint pain, even at 3 or 6 months after their infection seems to be over. Research is underway to guide physicians and patients in the best care and how to recognize and manage symptoms early. What makes brain fog last a long time or persist? We don't really know for sure, but a number of factors are at play. We think that patients who push really hard past the point of mental fatigue will have a bit of a rebound. We know that poor sleep causes trouble. We also know that a mood disorder or feeling anxious or lonely will add to brain fog. Background depression or being depressed about the COVID and the brain fog can be a vicious cycle. Poor diet, poor fluids, reduced physical activity are all possible contributors. We also know that some people exertion will actually aggravate them. So we have to be cautious about physical activity as being important to get rid of brain fog. We think that the two go hand in hand, that sometimes no physical activity is a problem, but too much can also amplify symptoms. We also have to be mindful that medications may be more easily affected or have side effects on the patient, even ones that they have been on in the past. There are other conditions that can affect brain function, and then COVID-19 amplifies those. So brain fog can be worse or last longer if the patient has had other challenges such as a learning disability, pre-existing sleep problems or insomnia, pre-existing pain, or mental illness. Many things will affect how the brain works. There is good news, however, if you can work on all these underpinnings and things that affect cognition or thinking, you can get better. And since many of these things are interconnected, changing one can affect another and have an even bigger impact on the patient who has brain fog. This slide is to remind me, and for you to remind yourself, that you don't need to do this module all at once. And if you're finding yourself a bit tired, you should take a break. If you're doing okay, in our next slides, we will be focusing on strategies and ways to help your brain fog get better. What can you do to manage this thing called brain fog? One thing that's very important is rest. Now, I'm speaking of true rest, not watching a soap opera, and even though the acting is poor and you know the plot before they even perform it, that is not really resting the brain. So you have to turn off some stimuli like TV, radio, music, as all those do require a bit of brain energy. You need to turn them off and really rest. Brains also need very basic things of water, salts, and sugar. You need to drink regularly and have an even, steady intake of your food so that you're not running hypoglycemic and not feeling hungry. We also need to gradually exercise the brain in ways that it can get better, but we need to learn what those exercise points are. When we make a muscle stronger, we all know that you go to the gym and you increase the weight or the frequency of repetitions or how many times you go to the gym, and that will make a muscle stronger. But we need to learn a little bit more about what are the impairments in the brain and how to gradually improve them. And you might need to be a little more organized, keep a schedule and record and track your symptoms, and find out what activities actually fatigue you and cause difficulty. This slide is a bit of a busy slide, but we'll gradually go through it. These are strategies that help you manage brain confusion or brain fog. Initially, we need to plan what we're going to do and chunk things into smaller bites. Sometimes people try to do everything at once in a way that they always did it before. An example would be laundry on Mondays. All the colors, all the towels, all the linens done on one day might be a bit overwhelming. But if you chunk the activity into colors, whites, linens separately, the activity might be less onerous for the brain and the body. We also need to prioritize what's truly important. Some things can really be deferred or wait till later, and some things really must be done. And once you get good at learning what you need to do, you can plan both to do the activity, pace it more slowly and in pieces, and rest in between. This is important, the rest piece of this. Additionally, we need to know that certain things will tire us mentally, some things will tire us more physically, and some things are more rote learning that we've done before, so the activity doesn't take as much brain power. So if you rotate things from something mental to something physical, something chores, something that you know well, and not try to do one thing all the way through to the very end, you'll often do better. The other big piece to this is to decide what's truly important And if it has to be done, you may need help, so delegate it to someone that you trust in your circle of support. Additionally, you might put things off, just defer them to a different deadline that will be adequate for your needs. And some things truly aren't important, and if you can downsize or reduce your burden of how much you have to do, go ahead and delete some things. Explain to people that you are doing this with, however, why you're doing it, so they can help you in prioritizing and help be a delegate for you. Brains are busy at a subconscious level all the time. We are taking in a lot of information, a lot of stimuli through our eyes, our ears, our skin, our joints, and we're processing it. We pay attention to some things and not others, and there are different types of attention that our brain is doing at a subconscious level. Sometimes we're selectively picking out one thing to pay attention to with our eyes or ears. Sometimes we're having two targets and dividing our attention between them. And sometimes we have to alternate between multiple things, and multitasking is very demanding. Being able to sustain attention, also called concentrate, and not flipping tasks around is also quite a draining thing to filter out other distractors. Paying attention to the right thing requires energy, and trying to pay attention to too many things can cause brain fatigue. There are some strategies that will help improve attention. Reducing distractions that you really don't need is the big one. Turning off radios, TVs, loud machinery, even reducing those distractions with headphones or sunglasses will help to reduce the irritation that those stimuli can cause. Sometimes you have to do a conversation one-to-one on its own, and your old ability to multitask or do a dinner party can be more challenging. Sometimes the patient will have to limit crowds and the crosstalk that they have, and to pace themselves for when they need to take a break. Some key strategies to improve intention are to watch out for fatigue, to get enough sleep, and to build in some basic body movements to break up the mental task with some physical breaks. Sometimes you need some strategies to help the world slow down. One phrase that really helps is to tell people, slow down, please. People will be willing to slow down if they understand you need more processing time. One way to slow them down is to say, just a sec, let me write that down. When you write something down, people will pause, watch you write it, and they will give you a chance to process that information. This also helps you to record a note for later and remind you of the conversation. Sometimes when you're on a phone, or the other person may have English as a second language or an accent that you can't quite understand, you may need to use a phrase that helps to slow them down. Sorry, I will need to get you to repeat that. Sorry, I'll need to get you to spell that. And that will slow them down and make things to be much more clear. Do a bit of body checking right now. Are you starting to get tired of this module? Take a break and do it later. Or stand up, stretch, and then we can keep going, as the next slides will focus on some more strategies. Many patients with brain fog complain that they're losing their memory, and they worry that there's something very, very wrong with their brains. In fact, it's more a processing problem, a software problem, and they need to just give their brains more strategies and time to memorize new things. There are types of memory as well as the types of attention. So we all have short-term memory to try and memorize a new phone number of 7 digits. Most of us could do 7 digits forward and 5 digits backwards, but sometimes even that task can be a bit more challenging to pay attention that long. The working memory is when you have more than one thing on the go and you're putting something on the back burner while you work on something on the front burner of your brain. And the long-term memory is like pushing the hard drive button on our save function on our computer. If we haven't worked with something in the short term and worked with it in our working memory, it is very unlikely that it will get stored to our hard drive. So don't expect to pull something off your hard drive if you haven't done the work of memorizing it to that solid state memory. So pushing something to solid state memory sometimes needs some extra strategies. The encoding process is getting information in, and the retrieving process is getting information out. They say that a very well-kept filing cabinet is something we can then find things in. Similarly, for our brains, if we've put things in an organized way, we kind of know where to search for them. Sometimes the problem is more with putting things into memory, and other times it's more of a retrieval problem, but really the two go hand in hand. What can you do to improve memory going into your computer? First of all, do all those attention strategies. Reduce the distractions, focus on a single task at a time, chunk, pace, and rest, write things down. And a few memorization strategies include repeating things, using multiple senses such as seeing it, saying it out loud, and writing it down. If you have to memorize something, if you can make it unusual or important, it might stick out. And conversely, if you put things into a routine, you can also help yourself to not have to memorize things. So link what you normally do with old memory, and that's where you will probably find that topic. Writing things down or recording can be onerous at first, but also quite helpful to encode information. A lot of people have this on their cell phones as a reminder list. Other people prefer the post-it notes that will be on the edge of their computer screen, and others will be like a police officer writing down their shift in a small pocket-type pad that they can whip out and remember the digits or numbers or activities that they're trying to recall. Try to make your life as routine as possible. Have the same place that you put your keys, your wallet, the incoming mail or bills, so that you know that that's the place to look for those things. And if you always put them in the same place, you're not running around the house trying to remember where you last put that item down. Retrieving what's in your hard drive is about as difficult as putting it in there in the first place. So retrieval strategies really depend on how you memorize them in the first place. So using day planners, calendars, post-it notes can be helpful. Having lists of things that you do at certain days and times. And again, those reminder lists can be made into some technology on your cell phone. Having a routine and having organization and a plan will help unburden your memory. Cognitive irritability is a symptom of challenged brains. So if someone is having some difficulty with attention and memory and processing a lot of information, it can be frustrating. And behaviorally outside, this can look like irritable nature. It's part of the spectrum of experiences people have, but not everybody gets this. Some people are irritable based on their sensory system being overactive. The skin, the labels on their clothing being rough, light being too bright, sound being too loud or interrupted, being hungry or in pain. Those will make the sensory system be more irritable. Everybody knows about those commercials on TV where someone gets hangry, hungry, and angry at the same time, and it's a thing. Making sure that the social demands are not so challenging when one is going to be hungry or tired is a thing. So being planned about your social experiences will be helpful. Planning ahead for situations that may be cognitively challenging includes being able to reduce the things that bother you. You might wear sunglasses to a bright event. You might take your AirPod Pro headphones in. People tend to leave you alone when you have those in, and if you're not feeling entirely social, you can be on the edge of the group with those in your ears. Sometimes just wearing comfortable clothing so that you're not being irritated as you participate in an event. You should let people know your limitations ahead of time, and we call it having an exit plan. Have that social excuse already planned out, that at half an hour I may have had enough. No offense to you, but I may get up and leave at that time, and I hope to not disrupt the group. The other options are to be paged out or have a call come at a time that then you can answer and say that something's come up. If you're at a busy dinner party and a lot of conversation may be expected of you. You might want to be on the edge of the group and have the people that need to have those conversations come to you rather than being in the middle of the party and finding it very challenging to hear them or challenging to process or reduce all the distractors around you. If you set up structure and schedules, it can help you. Sometimes setting an alarm that goes off to remind you to take your pills, to remind you that it's time to take a rest. Those type of personal alarms can be very helpful to manage and reduce cognitive irritability. So I'd like to summarize what we've gone over in this module. People report that they have cognitive blunting or brain fog after COVID-19, and it can last several weeks or even months. One common symptom is the blunting of the thinking power. They call it brain fog, but it's not a specific diagnosis. The strategies that can help reduce brain fog, and you have to use these strategies and you'll function a little bit better, and it will actually help to exercise the brain in the right direction. The main strategies that we have talked about in this module include managing sleep, anxiety, mood, diet, and nutrition, making them routine, getting a bit of regular exercise, avoiding too many medications or alcohol that sedate or confuse you, and using strategies to improve attention, memory, and retrieval, reduce distractors, using tools to record and remind, and pacing the challenges so that they're more successful and accomplishable. Here we provide some links to other resources for learning about brain fog and strategies to manage symptoms. The National Health Services of the United Kingdom has put out a number of brain fog and fatigue management resources for patients to link in on. Our own Provincial Health Services Authority website has this module and other tools and handouts that you may find useful. A symptom monitoring journal is also available for you to maybe look at as a resource. And there are post-concussion modules available, and concussion is very similar in the brain fog experience, so some of the strategies carry over quite nicely. This is the link to the United Kingdom series, and I highly recommend it as a journey to go through some of their links and handout material. This concludes the module on brain fog, part of the post-COVID-19 recovery education series.